Dr. Katrin Machalala, who is a member of the World Health Organization's One Health high-level expert panel and a senior policy advisor to the EcoHealth Alliance. Please.
Thank you, Walter, and thank you everyone for the opportunity. I'm just going to put up my slides here, and I'm really honored to speak about this topic, about how do pandemics occur, building on the excellent and really compelling presentation from Dr. Bernstein. And I think this question is so important because if we understand the problem, we can do something about it. So we heard, really about the enormous scale of the problem when we think about how rapidly and profoundly we're changing the environment every day. And this is human activity. And at the same time, we face this enormous scale of the problem from existing diseases. We see that the majority of known human infectious diseases are shared with animals. These are these zoonotic diseases that cause burden every day to individuals, to communities, to our world as a whole. And even for the known ones, we still have challenges in addressing these, including things like ancient viruses like rabies. So we have the increasing emergence of new pathogens, and there are a lot of them out there. So we're changing our environment very rapidly, while we still really don't know sort of what's the next COVID-19. I think that's something that we should really be concerned about, and not just from a global pandemic risk, but also from really local impacts of epidemics and spillover events that occur every single day and really impact those that are most vulnerable. Now, when we think about the drivers of disease emergence, so these are the factors that we heard about, like land use changes such as deforestation, mining, habitat encroachment, the way we're really changing land very quickly, and we're changing ecosystems, and we're changing the interactions between species. Of course, there are many different factors that are happening at the same time. When we develop a landscape, we're also building new roads, we're bringing in people, we're extracting wildlife to then go into wildlife trade. And these are just creating the opportunities for spillover events. What I think is really important to note here is that these drivers are shared for multiple critical challenges that humanity faces. So when we think about biodiversity loss, when we think about climate change and disease emergence, these are shared priorities that we have to be working on, these root causes. I think that there's a lot of opportunity then to maximize our investments, have those co-benefits that Dr. Bernstein mentioned. Now, when we think about land use change, this is the major driver, the root cause of a lot of epidemic and pandemic risk. And there's a major challenge when we think about how to be more proactive. So currently, disease risk is not factored into environmental and social impact assessment. We're just not aware when we change an ecosystem, what's likely to happen. So all of the ecological changes, this web of interconnectedness with our ecosystems, how we disrupt food webs, how we bring in new species, invasive species potentially, livestock farming, and changing these interactions that allow for spillover. I think that if we really prioritize assessing these risks ahead of time, we can, very cost effectively build in risk reduction into project design. Some projects will look very different. The equation between, the costs and benefits of a development project may shift when we think about disease risk, but we can really build in smart investments and make sure we're proactive and mitigating risk from the start. Now, I think it's useful to think about the hotspots of disease emergence. So this is where we're likely to see future pandemic precursors, the pandemic threats really emerging. And you can see here in yellow, these are the hotspots, and they're mainly in the tropics. They're where we have a lot of mammalian biodiversity, and there's also a lot of pressure on those ecosystems, natural resource extraction, deforestation, primary forest loss, and also increasing populations and increasing demands from all corners of the world. We're a globally connected society. And at the same time, these areas are those that are the most vulnerable. So if something does spill over, they're the least equipped to really detect it quickly. Unfortunately, many communities in the world don't have access to rapid diagnostics. So it's do we know if it's malaria? Is it something entirely new? This is an equity issue. We've seen that with the vaccine, of course, and everyday access to healthcare. Many communities simply can't access the services that they need. Training and workforce opportunities, food security. So when we think about high risk practices, why people engage in these practices that may lead to spillover or increase the risk of spillover, it's often a basic, feeding our families and livelihoods. And, I think we have to think about that and how we're changing our land when there's a concession for mining or timber logging, who actually has ownership over that land and stewardship of it. So there's a lot of equity considerations when we think about, the challenges and solutions. Now, emerging infectious diseases also affect other species. Again, it's not the fault of wild animals. This is really human activity. And we see that there are consequences for biodiversity and its intrinsic value, but also for human well-being and all of the ecosystem services that are lost when a species is decreased or goes extinct. And so we're actually having these long-term consequences, loss of pollination, affects our food system, and those that are the most vulnerable and least able to cope, to adapt, are the ones that will be most effective. So I think from an equity issue, when we think about other species and biodiversity conservation, as well as our own health, we really have to think about how pandemic risk is affecting other species too. Now, it's also important to think about solutions, and I know our colleagues will speak about that in the next panel, but we have to keep in mind that we're not prepared. There's no global authority tasked specifically with pandemic prevention. We do, I think, a really good faith job at responding effectively, supporting countries, working with communities, everyone really trying to work together right now in the moment of the pandemic to find solutions, and that's challenging enough, but we need to work upstream. We need to have multi-sectoral collaboration. We need to understand the problem, and we need to work together to really focus on prevention before we see spillover events occur. There are some really exciting initiatives. There's a great collaboration now between the Food and Agriculture Organization of the UN, the World Health Organization, the UN Environmental Program, and the World Organization for Animal Health. So working together in new ways, sharing information in new ways. And there's also the One Health high-level expert panel that's advising on that work. But at a country level, at a community level, we really have to be thinking about the root causes. And that's not the health community in terms of entry points. That's really addressing risk way upstream. I just want to close about some of the work that we've done with the World Bank. And the World Bank and many other partners are really embracing a One Health approach. So human, animal, and environmental health, all of the connections between them, and the opportunities to work together. That's what we think of when we say a One Health approach. And when we really thinking about moving ahead of the curve, the epidemic curve, when we see the spike in human cases, that's shown here in red, we want to be actually working upstream. So we use information that's already available, already collected from other sectors, reporting from forest rangers, from farmers, from veterinarians, from climate scientists, and anthropology on human practices, bringing that information together so we can really understand the problem and reduce risk. So I think that gives me a lot of hope what we can do to prevent future epidemics and pandemics, but we really have to work together and find ways to prioritize pandemic prevention. So thank you so much for the opportunity and looking forward to our further discussions. Thanks.
Thank you, Drs. Bernstein and Machalaba, for illuminating the root causes of pandemics and pointing out that there is no global authority to address this issue yet. We're really lucky to have such respectable experts with us today to share their wisdom. Please hang with us. I'm sure we'll come back with some questions and discussion with you in just a bit.